Okay.
Hello. Good morning.
Okay, I think we're going to start. Welcome, everybody. Sorry for the technical difficulties at the start, but I guess that's our reality now, so we're just going to have to deal. I'm Laura. I'm the CEO at VMV Hypoallergenics, and with me is my mom, Doctora Veralio Rao, and she's our founding dermatologist and dermatopathologist. She is, as a lot of you already know, because a lot of you are probably her patients, an expert clinician, multi-awarded, published, big brain. She teaches, she freaking lectures everywhere. Anyway, she's a big deal. So say hi, Mom.
Hello, everybody.
And happy advance.
She's my
Mother's
daughter.
Day.
You know?
I know, but that means I'd be more honest. So there. Oh my God, everybody's sweating. Okay, so today we're going to be talking about stress and skin. I think I'm the perfect example of that right now because of the technical difficulties. I had to run around and basically worked myself into a tizzy. But a lot of us are feeling stressed because of the global pandemic and the situation that we find ourselves in, the uncertainty. And I think it's actually a good thing to allow ourselves to feel vulnerable and scared and angry. But prolonged stress is never a good thing. It's really something we need to manage. We're also seeing an increase in stress from studies because of being cooped up at home. Virtual schooling, I think, is the new thing for a lot of parents. And there's intergenerational stress, which is interesting because some of us are taking care of kids and schooling and whatnot, but also worried about our parents, right? Especially those that don't live together, like we're lucky enough to do. But to get us started, my mom talks a lot about, actually one of the things I think I really, really like about her approach to dermatology is it's never just about the skin, never just what you put on it, right? So I've heard you talk a lot about skin, nutrition, sleep, stress, mental health, exercise, and how they're all related. And there's been reports of increased levels of stress. And one of our viewers pre-submitted a question, which I think is perfect to start us off, which is how does stress manifest on the skin? Like, what are the common skin problems you tend to see with stress?
Interestingly, just about every a patient who comes to see me, when I ask them, what do you think was the trigger for this one? And they'll usually immediately say stress. Stress is basically the ones that they're talking about is psychological. Psychological from not being able to sleep, psychological because of even an underlying infection, psychological because they're not eating the right food, but primarily psychological, angry at the little boy who doesn't seem to be doing what they should be doing. Anyway,
was that a slight hint at my son? He's doing so good.
Yes, he is.
Okay.
I have no complaints there. Okay, going to evidence. Let me talk for you first, defining what I call functional dermatology. That's what I really practice. Is when a patient comes to see me, I ask them not just about the disease, but also about themselves, And then beyond that, to look at evidence. So what I'm going to tell you, therefore, is evidence on how stress affects the skin. Interestingly, despite the fact that everybody says stress is their main thing, there's really no good evidence about what stress does to the skin, except for one important thing, and there are many studies on this, that the stratum corneum is the barrier layer of the skin that gets disrupted due to stress. So for instance, there was a study on kids who were on summer break after a very heavy, stressful exam, couple of weeks. And then they measured what we call the transepidermal water loss and the cutometer for hydration of the skin, etc., etc. And every now and then, every so often, they would always show that there was a disruption in the function and repair of the skin barrier. So what does that mean? As far as you and I are concerned, with stress and epidermal skin barrier being disrupted and the repair being poor, we need to look out for when wrinkles begin to appear, little spots appear on the skin, even going into bigger ones called melasma, because the skin is disrupted. So there, it's basically that. So that bottom line, therefore, for that we need barrier protection, and there are lots of creams now and ointments. The simplest is really putting petroleum jelly on your skin, but who wants that, right? There are other.
We have something better. I'm not allowed to really talk about that because we have to be ethical because she's a doctor.
You can look for
but y'all know.
You look for barrier. you look for barrier repair kind of products. They usually have ceramide or an oil, and I prefer coconut oil for many
You do?
fantastic reasons. Yeah.
Sorry, it's a joke in the house. You can't walk 10 feet in this house without running into coconut oil. Okay, so our new partners in Russia. Hi, Russia. It's too early for you, but I'm excited that we're in Russia now. Be Hypo. They asked this really cool question about cortisol. Cortisol is the stress hormone. And how does it have an impact at all in the skin?
Yeah. Cortisol has so many side effects on the skin, actually. When you're a teenager, an adolescent, the acne that you get is what we call adolescent acne, and it's primarily driven by hormones because of the surge that comes, that I'm beginning to see in my grandchildren. The surge of the hormones, right? So they're androgenic, a number of them. And so that's why you get the pimples going onto the cyst.
I think we have to speak up because we have insects now.
Right.
The crickets have come out.
Yeah. So when you're an adult, there's many more adult acne cases now, even to 60-year-old people and beyond. And the reasons for that is no longer the adolescent hormone. It's now due to the hormones from cortisol because of stress. With stress, you have increases in your cortisol levels in the body that is produced by the body itself. That added to that, a lot of people will use powders from the gym that are supposed to build up their muscle and all, and they are hidden by names that you don't really recognize as hormones, or added to vitamins and supposed to be, antioxidants. So you have to be careful about them being hidden in food. And as a matter of fact, feeds are also being given with steroids because it makes them grow bigger and fatter and longer. So that's the effect of cortisol, is both hormonal. I mean, acne in adult and adolescent, they're both hormonal, but one is due to the surge of hormones that are in fact androgenic as well, and the cortisol in the older person. And the bottom line for that is your skin from that perspires more.
I'm apparently here just as an example of the negative effects of stress.
Right. Becomes drier. Barrier repair is also compromised when the steroids are there. And by the way, let me tell you, there are lots of creams out there that have hidden cortisone or is pure cortisone itself. So people can buy them just about everywhere. Be very careful. My bottom line advice always to people is, come on, read the back label of anything that you put on your skin. Okay. Know what it is.
You're going to hear that a lot. So in essence, so far, what we've learned is stress does have an effect on the skin, right? But the evidence is strongest with regards to its effect on our barrier layer of the skin. The barrier layer of the skin is really important. For example, to give you an idea, if you have psoriasis or eczema, a degraded barrier layer is actually one of the bigger issues. So that is a big issue. Then secondly, cortisol, which is the stress hormone, right? You release it more. Was it fight or flight, I believe, does affect the skin as well. And this time on the opposite end, if we think of barrier dysfunction, it's usually very dry and cracked, right? But with cortisol, we also see now a rise in acne. So you're kind of getting both of the ugly things, right? Extremely dry and or adult acne. Right. So yes, it does affect the skin.
May I add something more to stress? The two other things that are very important during this time of COVID, as far as the skin is concerned, is that there's so many chemicals out there, primarily chlorine-based, or any of those other chemicals which are called halogenated. The problem with the chlorine on your skin being brought up there by the air, because chlorine evaporates, right? You can smell it, and when you're cleaning up, it lasts forever, that scent, right? The thing is that it becomes airborne, and the problem with chlorine is that it is photosensitive.
Yeah.
So that it now gets into your skin slow. These are small little doses, but it makes your skin therefore react to it, become either irritated or have an allergy to it. Contact dermatitis is what it's called, or aided and abetted by the sun and by the indoor lights and the monitors that you're using, it then becomes photoallergic or photoirritated. So all of those combined make your skin dry, red, more rosacea, more scaly skin, and over time you may get earlier wrinkles because of this COVID thing that's going on, simply because you're trying to have antisepsis in the house. Okay, so that's one. The other thing is that your skin during this time, everybody's talking about COVID. I'll tell you what, there are more bugs in the air beyond that virus that we're all trying to, get rid of. And we already talked about the barrier disruption, right? Well, the barrier disruption from that, the barrier disruption from the stress because of the chlorination and all of that, those will disrupt the skin so that you're more prone to secondary infection.
Okay, wait.
So stuff it.
Let me unpack this, because there was a lot, but that's why she's here, and that's why she is who she is. So again, stress, does it affect skin? Absolutely. We see it a lot with disruption of the important barrier of the skin. When it gets very dry and cracked, what she just said is you become now more susceptible to secondary infections. And actually what she sees a lot with her patients, because she tends to handle really, really complex cases, they tend to get complex because they start with, say, an autoimmune condition like a psoriasis or eczema, and then it gets even more complicated because now there's a secondary infection. Some microbe has gotten into the disrupted barrier and caused a secondary infection, so now they have to deal with that. Sometimes she'll see people who, because of that secondary infection, have been treated or overtreated with various drugs, and who might even have developed a drug allergy. So now she has to wean them off of the drugs, or steroids, and sometimes weaning off of steroids requires hospitalization. It's no joke. And then she has to keep getting to the underlying issue. What is the underlying issue? And many times you'd be surprised to know the underlying issue is very, very simply, you were allergic to, say, chlorine, and you don't even realize how you're getting exposed because you're cleaning the house so much, or another contact allergy. I've seen so many cases that she's handled who have been decades long, hospitalized even, and after you get through all the complicating issues, it turns out it really is just a simple matter of allergen avoidance. Okay, so that's sort of unpacking what she just shared there. Going back for people who joined us just now, stress does affect the skin. It affects the barrier layer. It does cause dryness. All of this dysfunction to the barrier layer can lead to other things like hyperpigmentation and wrinkles and dryness. It can definitely trigger eczema, flare-ups, psoriasis and such. And cortisol, being a hormone, the stress hormone, can totally trigger adult acne. Okay. Moving on to another question, because I know it's really related. Stress is inflammatory. Right, so everyone talks about inflammation and how important it is. Two viewers actually pre-submitted this question, which is stress, inflammation related to psoriasis and eczema? I think we all know the answer.
Right.
Can we talk a little bit about inflammation?
Every patient I have with psoriasis and eczema, when asked, will say, "Ay nako, it's due to stress. When my husband has to leave because, he is on whatever duty in the emergency room, or other kind of stress factors like not being able to sleep." That's another subject, by the way. Lack of sleep. I hope you don't mind my segment, because this is very important for stress. Lack of sleep has been shown in a number of studies, and there are two in particular that I will quote to you. One is written by Dr. Barron and her group at the Western Reserve University, which showed that what they call the Pittsburgh quality of life, they in patients who lack sleep or have no quality sleep or have interrupted sleep or sleep in the nighttime, in the daytime rather than at night, and therefore lack the circadian rhythm, they all have dysfunction of that barrier again. I don't know why the barrier is so much a problem, but it is the barrier that gets affected by stress from lack of quality sleep. You know, there are lots of people in the Philippines who work at night. I'm sure it's not just in the Philippines, but in other countries around the world. They work at night, including doctors and nurses, by the way. So they work at night, and therefore they sleep in the daytime. That's not quality sleep either. It's not circadian, and barrier again is affected. So among the external factors that can age your skin would be the problem of lack of sleep and stress, psychological stress inside. I'm sorry. Okay, where was
Inflammation.
I? Inflammation.
This is where we were
all
going
of
with
this, all of this will produce inflammation. If it were the sun, for instance, it's DNA damage. If it was everything else, it's oxidative stress. That means there's oxidation going on in the body. And that's why people take antioxidants, by the way. And the antioxidants should be another subject we can take on the next time.
Take it another time.
That's a long subject. I've written about, I've made research on, including a fantastic paper that should be coming out sometime this year that includes biopsies we did on psoriasis patients at baseline and after 28 weeks of a particular diet. And
that's right.
it was fantastic.
It was phenomenal.
Both in the clinical parameters and measures and all that, plus RNA sequencing, biopsies that we had, immunohistochemistry examinations. Anyway, that's another topic. It'll be exciting to let you know about the antioxidants you're taking. This is my antioxidant.
Okay, it's turmeric tea, but let me again try to circle back because, and she knows this and I love her for it, but if you let that brain go, we will be here till 4 o'clock. So again, in the summary, stress does affect the skin. We see it a lot in barrier dysfunction. Barrier dysfunction can lead to many skin problems, including wrinkles, potentially hyperpigmentation is a sort of a secondary effect. Because you become more susceptible, say, to photoallergens, you become more susceptible to secondary infections of the skin and other things, and cortisol can cause adult acne. Stress is inflammatory. Inflammation causes many problems, and yes, eczema, acne, psoriasis, rosacea, all these things are really, really inflammatory diseases. So if you can control the stress, that's kind of crucial. What I want to insert here, and I think she was going there, is stress isn't just that awful antsy sort of, anger and fear and anxiety that some of us feel, or many of us feel at different times. Stress is also bad food. Bad food stresses the body because the body has to work harder to process it, right? See,
a good student.
I listen. I listen. Every day is like a quiz at home. I listen. So bad food is stressful to the body. Lack of sleep is stressful. It's just awful for you on every level. Also, what you apply to your skin can be stressful. So we're also talking about skin stress. Repetitive exposure to allergens and irritants stresses the skin. And again, this stresses the barrier of the skin, and again, can lead to these cracks and secondary infections and whatnot. So far, that's how we're doing. Let me go quickly to a question. We asked about a good product for stress triggering eczema. Basically, I think what you're going to hear a lot from both of us, and since it's product, I'll jump in here quickly. You want obviously something that's as gentle as possible, something that will not stress your skin, because if you're already dealing with mental stress or sleep or food or whatever, the last thing you want is to add to that with irritants like chlorine, and from all the cleaning that we're doing now, allergens like cocamidea, fragrance, preservatives, dyes. Realigned or what? I'm so tickled.
Fantastic.
So the least allergens you can get, and you'd be surprised how many things are made for eczema, rosacea, sensitive skin that contains so many allergens. So you really have to look. And what we do, you can send a private message to VMV, and we can look at your patch test results and help you select products based on your particular allergens.
Or go to your dermatologist and have a patch test.
Yeah, patch tests are just life-changing. We're such
Absolutely.
big fans. Okay, someone asked about... Oh my God, there's so many. Okay. When I'm stressed, my scalp gets itchy and flaky. This is from Georgia Martelino. What can I do to calm the irritation? She has a nice trick here. Should I just do it because
Yes,
it
go
mentions
ahead.
products? Okay. Before you shower, you put boo-boo balm. You comb it through your scalp because it serves as a protective barrier. And then I would suggest the Clark wash, which is the mildest shampoo that we have, and conditioner. And sometimes what she also likes is VCO, virgin coconut oil, like Noad oil. And then you wrap. You do like a hair wrap with cling wrap for like 20 minutes or something. Basically, you're trying to calm it down. A lot of these products that I mentioned are anti-inflammatory, very soothing, calming. Plus, they help with the dryness and the broken barrier. Okay, trying to make sure I don't... trying to make sure I don't miss important question, guys. I'm sorry, there's just so many to go through. Apart from skincare, I like this. This is from Nature Lava Singapore, our partners in Singapore. Hello, I hope you guys are well. Apart from skincare that we apply, is there anything internal? I think I read that wrong. Here we go. Are there any nutrition supplements to reduce stress and inflammation?
I never believe in supplements as a rule. I believe more in natural and organic, even better.
Yeah, so okay,
That should be another.
Fair enough, but as a
That's
general,
that's a long one as well.
and now we have a car. But as a general rule, get your antioxidants and vitamins through food, and maybe a tea like what my mom is drinking now, because a lot of these things don't survive the processing into pills. They're very, very unstable. Vitamin C is a classic one. It's really unstable. It's hard to get into pill form.
Sun, heat, and light.
There you go. So among the supplements that do help, she's a big fan of melatonin. It's a great antioxidant, anti-inflammatory, plus it helps you sleep, so that's nice. And it's not addictive because it's not a drug. It's something secreted by our brains. She's also a big fan of biotin, vitamin D, calcium. These are things that we know can survive the processing into supplements. Otherwise, eat healthy, guys. It's all the stuff that our grandmothers and great-grandmothers told us to eat. If they wouldn't recognize it as food, don't stick it in your mouth, is what I'm saying. Okay.
And the closer to table, the better. So not in cans
Yeah.
or in bottles.
Oh, Pinky Lapu says her first aid for eczema is boo-boo balm. Mine too. And we hear you. I've been seeing you're relating to stress and how it triggers you. And I can't pronounce your name, my dear. JKCZE. My Lola developed psoriasis at age 93.
Yeah, there you go.
Could processed food have triggered this?
That might be a psoriasiform drug eruption because at 93 it's very rare to get psoriasis at that time. So there is another case where you'll have to look at the trigger or confounder.
Okay.
That's probably a drug.
We're probably going to do just maybe 2 or 3 more questions, and then
Excuse me,
we'll
I
let you
hope I
guys
didn't
go.
get into anybody.
Not at all. Okay, so someone, a Spectacular Ray, I had my patch test 10 years ago. Do I have to do it again? If so, how often?
10 years is good for you to
Yeah.
repeat it. Yes.
You know, our bodies do change, right? I always find it funny when people are like, I'm not allergic. I'm never allergic. And I'm like, give it time. I developed a nickel allergy late in life. I developed a penicillin allergy with my second child. And then I outgrew them on some allergies. So things do change, right?
I'll give you an example. I had a patient who's severely, inflamed, hospitalized to clear it out, nursing care and all of that. I then did a patch test on her, and her back was what you call the angry back. She had so many positives. I waited a year when she was much, 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 much clearer. Repeated the patch test. This time it was fantastic. It would show just a few and very distinctive 2 to 3 plus reactions. So now, yes, have another patch test. It will be meaningful.
Guys,
if in the meantime you had rashes that
we
continued.
can do a series just on the funky patch test stories that we've, amazing stories, really cool. Okay, very quickly, Shai JV. What can you suggest, please, for adult acne?
Adult acne, find out the cause. Chlorine, by the way, is acnegenic.
Right.
Just so you know.
I'm going to delve into this quickly. So a lot of the time, people just treat the symptoms. And one of the things that she's been extremely sort of consistent about in her practice has been, we have to know the cause. If we don't know the cause, just treating the symptoms is never going to work.
That's right.
So a lot of times with your dermatologist, be patient. It's an investigative process, right? You might need a patch test. Then even if you've had your patch test and you're like, I'm avoiding everything, then you might be upon
need a
further
scraping.
Exactly. There's other stuff to do. It takes a while. Okay. For adult acne, causes could be hormones, stress, like pardon me, lack of sleep.
She's choked.
Pardon me. Cortisol, etc. Could also be comedogenic stuff on your skin. So look for non-comedogenic everything: shampoo, conditioner, makeup, soap, etc., etc.
Yes.
Yeah, I'd like some water, thank you. Okay, and as a nod, can a person be allergic to coconut oil? Is there anyone that doesn't react well to it? I'll let you.
Once a doctor sent me a note about some patient from somewhere up out west in the United States. But that person was given by somebody from another country coconut oil, and my friend said, who's a very well-known expert on contact dermatitis, she said, what happened here, Vern? So I asked her to send me the bottle or take a picture and let me see and read it. When I read the back label, it said, this coconut oil is very special. It's been refined, it's been bleached, and it's been deodorized so you don't smell anything and it doesn't become a white butter in a cold environment. Well, immediately I said, the reason this is an irritant is because this is cooking oil. And they made it into bottles and said they could use it on their skin. So folks, again, read labels.
Yeah.
And when you get a reaction to coconut oil, email me directly. Tell me, because I am looking for an honest to goodness reaction to coconut oil.
Okay, I'm going to jump in quickly again just because we have to start winding down. Coconut oil in medical literature, actually, you guys can search it up yourself. There's no real, it's not a top contact allergen at this point. Reactions that have been reported are usually to coconut oil like that, which is RBD, refined, bleached, deodorized, which is actually really good oil for cooking. Cooking oil, coconut oil is really the best for you. If you don't like the flavor, RBD oil is actually still really good. And then olive oil.
For cooking.
So, yeah, for cooking. But for skin, organic, cold-pressed, virgin coconut oil is not allergenic and not comedogenic. I don't know what's going on.
Just so you know, we are doing a study in the Philippines. I'm doing it in 2 big centers.
You're not allowed to talk about that yet.
Okay, I won't tell you yet. It's
recommended for acne, id gel. Okay. Just as a nod to Mother's Day, which is in a few days.
Oh yeah.
If we're going by, if we're going by all the memes of day drinking and stressed moms and stuff, what are some of the more common concerns that patients have? I think it's about the same when they're pregnant or have newborns. And what to look for in products for babies and new moms.
You asking me?
Yes.
My mind wandered off.
Okay. Babies and new moms, same banana.
Babies and new moms.
What products? Hormones are raging.
The simpler, the better.
The simpler, the better. Virgin coconut oil, monolaurin, which is found in breast milk anyway.
Yes.
These are wonderful. Virgin coconut oil is actually added to some premature baby nutritional supplements to help get them up to speed nutritionally,
And lastly, we're now processing protocols for studies on microbiota in patients with atopic dermatitis. And the studies basically is on patients who we know will most likely develop atopic dermatitis because the father has it, the mother has it, and all. But we examine the microbiota on delivery, basically, as a very young infant. And then find out by using moisturizers, for me it would be the coconut oil that we're going to be using versus something else, to see if the microbiota of that child is changed by the use of something else over some very good moisturizer or something like that. But microbiota is established. And the other thing about microbiota is, please try as much as possible not to have antibiotics constantly given to children, because that tends to also change their microbiota.
That's my problem. That's why
Born
I
and raised in this small little coastal town in Cebu, called Bogo.
Hala, Cebu.
I have microbiota that, no microbe likes to come to see me. I haven't had the flu. I haven't had any of these coughs and colds that most
I'm going to
people have.
interrupt you just because it's so late, ma'am. We have to go.
Okay.
Okay, so
Cheers.
I'm just going to pass through this. That's Ingrid Santa Maria. That's a good friend of my mom. She's awesome. Listen to her
Good
play.
for meditation. Listen to her music.
Okay. Sorry, someone did ask, if you can't control stress, are there any hacks for skin? The first thing I want to say to that is you can totally control stress. There's so many options now, right? Between meditation, EMDR, talking to a therapist. There's just so many. I really would prioritize that. But if it really is a struggle now, at the very least, make sure your skin isn't being stressed. She has a meeting. I'm rushing. Does oil pulling help? It actually could, but this is all theoretical. For a lot of these answers, please visit vmvinskin.com. There's a lot of stuff on there, even including what is a patch test, different allergens, coconut oil pulling, psoriasis. What products can I give my husband all over? Psoriasis, your husband might need a biological. This is really something that needs to be managed with a doctor, particularly now where we're looking at a pandemic, right? And biologicals can be immunosuppressive. So this is something to talk to your doctor about.
I'm going to have a big meeting tonight about
There
that.
you go. So that's why we're rushing. But again, reduce stress sores on the skin, eczema, psoriasis, rosacea, acne, non-comedogenic, hypoallergenic, irritant-free, etc., etc. I am going to start ending this puppy because she's got to go. She's got a full day and I don't want to keep you guys on. But please keep your questions coming. You can put them here on Instagram, Facebook, vmvhypoallergenics.ph in the Philippines, or .com all over the world. We also have Mother's Day treats and stuff, so that's cool because you can show mom you care. It's like a hug in a bottle or a tube instead of actually being there. And we will be doing these live streams every Friday, 9 a.m. Manila, which is Thursday, 9 p.m. Eastern Standard Time in the U.S. And next week, set your calendars already. It'll be a huge topic, which is virgin coconut oil and monolaurin, and clinical studies on their antiviral and antimicrobial efficacy. So that'll be extremely cool. DM us your questions in advance, and we'll tackle as many as we can. Oh my goodness, what a day. This started hectic. It's ending hectic. But I will be doing my own stress management and deep breaths. Thank you so much. This woman started me meditating at age 6, so I will go to that happy place. Thank you guys very, very much for watching, and advanced Happy Mother's Day. Bye-bye.
Happy Mother's Day and Happy Mothering Women's Day.
There you go. Exactly. Anyone who mothers, whatever gender, animal, if you love your dog, you're mothering your dog. Okay, bye.
Bye-bye.
And now.